toll of the pandemic. Today we released the excess deaths estimates associated with COVID-19 pandemic. Excess deaths include deaths directly and or indirectly attributable to COVID-19. What we released today is a staggering number of 14.9 million excess deaths since the start of the pandemic from January 2020 to December 2021 in a period of 24 months. What we also reported today is that majority of these deaths occurred in Southeast Asia region, followed by Europe and the Americas. Majority of these deaths occurred among men than in women, and also among people who are 60 years and older. It is important for us to have. This is extremely important information for anyone to have, especially policymakers and the public. We need to know the true toll of the pandemic. And excess death provide us that metrics to assess the true impact of the pandemic. It is important for policymakers to use this information to design the right policy solutions. If we don't estimate properly, correctly, there is a risk that we underestimate, and when we underestimate, there are many chances for us to underinvest in public health. Another important reason is when we undercount, there is a big chance that we might miss where the right interventions are needed, and we might exacerbate inequalities. And COVID has illuminated that there are significant data gaps, and this also highlights the urgent need for policymakers to invest in good data and health information systems. And finally, and most importantly, the tragic loss of lives. And we have to remember that behind these numbers are people. Today is that majority of these deaths occur. COVID-19 has illuminated the staggering data gaps in countries. We know that data is the lifeblood of public health, and not all is good in the world of data. Too much is unknown. There is too much delay in getting life and death information. We conducted an assessment 2 years ago, and we found that 6 out of 10 deaths globally are not registered. And 9 out of 10 deaths in Africa are not registered. It is also important for us to remember that over 70 countries do not have accurate cause of death reporting. And as you know, that we needed to know the direct and indirect impact of COVID pandemic. And to assess that, we needed information on deaths and causes of deaths. And we have seen that countries have lack of capacity. And this lack of capacity is a result of long-standing lack of investments in data and health information systems. So this truly is a clarion call for all governments to invest in civil registration and vital statistics, and also good integrated surveillance systems and health information systems.